Are you opening for us, Nicola? Brilliant. Do you want me to pop my slides up?
Yeah, by all means. Just giving people a moment to,
Lovely. Thank
join
you.
us. Okay, just to let everybody know, we will be recording this session. That's so we can make it available for those people that aren't able to attend today. So welcome all. For anyone that doesn't know me, I'm Nicola Jones. I'm the Director of Risk and Compliance. And we've set up a series of seminars looking at the different quality statements that sit under the CQC's domain of Well Led. And we've done it at this point in time really to prepare us for the Well Led inspection that's currently underway, but also been really interesting in the seminars we've had already to really remind ourselves of some of the amazing work that's going on across the organisation. So today's session is looking at capable, compassionate and inclusive leaders. And Paul and Joe are going to kindly take us through the session. The idea is that we'll have some time for them to take us through, and then we'll open up to sort of questions, comments and discussion at the end of the session, and hopefully there'll be plenty of time for us to talk through any questions people have. Is that okay with everybody? Lovely. I shall hand over to Paul and Joe. I'll also keep a bit of an eye on hands. Emma, do you want to just come in there before we launch off?
God, no, that's an accident. I meant to give you the thumbs up. Apologies.
Thank you, Nicola. Paul, shall I get us started?
Yeah, that's great. Thanks, Joe.
Brilliant, thank you. I can't see a thing if I go on to slideshow mode. So if it's all right with you, I'm gonna use the slides like this so I can see you. So this is just a quick overview of all of the different sessions that are being run. Thank you, Nicola, for your support in organising all of these sessions. They link to all of the well-led statements. And the reason I've put them up is because we're already finding that there's a lot of crossover. This is all about being well led. And so we're already finding that a lot of the conversations are kind of similar across all of the well-led statements. So we might find some of that today. So if there is any overlap, apologies for that. And if not, then, you know, we've got the chance for a couple of other sessions if there's stuff we need to still add in. So here we've got the statement. Oh, can you just carry on? I'm going to turn my phone off, please. Sorry. Can you just carry on for a sec?
Yeah, I think it's also just worth saying that before we get into what the well-led statements mean, is that within a 45-minute seminar today, what we're not going to be able to do is clearly to be able to sort of set out what a compassionate leader is, because you know, that's what we're going to have to develop over time through various programs of work. But what we want to be able to do is set the standard of what CQC will be looking at and how you might then relate that to the work that you're doing. Joe, do you want to sort of kick off with what CQC are after in this?
Yeah, thank you, Paul. And for some reason, my screen keeps stopping sharing. So can you see the slides at the moment?
We can see the slides, yeah.
Good. Okay, they keep disappearing, then I keep resharing. So let me know if they drop off. So this is what the CQC are looking for in terms of the capable, compassionate, inclusive leader statement. That is, we have inclusive leaders at all levels who understand the context in which we deliver care, treatment, and they support and embody the culture and values of their workforce and organisation. They have the skills, knowledge, experience and credibility to lead effectively, and they do so with integrity, openness and honesty. And so some of the subtopics that we'll be covering off today are around leadership competencies, support and development, safe recruitment of leaders, FPP, I'm not sure what that means actually, Compassionate and capable leaders, roles and accountability, succession planning and talent management, and an open culture where speaking up is celebrated. And the way that the CQC will have a look and see whether we are well led in this domain is around obviously feedback from staff and leaders, feedback from our partners, real lived examples of leadership process. And I think that's going to be really key here. And I've heard it in some of the other sessions. There's a lot of big words in these slides and a lot of big words in all of the statements, but it is that stuff on the ground day to day that you are all doing and you know that you're doing that they will be looking for. So, you know, those real live examples of where you understand when your staff are in Ramadan and how you change the way that you hold your meetings and you have your lunch breaks because of that. Those simple things that you are doing as inclusive leaders are really those live examples of well led. And I'm sure as we go through, you'll be able to think of some of those. And if you do, talk to us about them and let us know what they are, because others of you as well will then be thinking, oh yeah, oh, that's quite simple. We do that as standard. And then of course, people's experience of health and care services, our patients and our communities. So what good looks like, this is some of the things that I've described, and I've actually had a look at some other CQC reports from good organisations and our own CQC report from our last inspection. And I've listed some examples here of what I think good looks like. So managers and leaders are suitably experienced and qualified. Leadership roles and responsibilities are clearly defined, and supervisions are up to date and appraisals are up to date with clear objectives. We as leaders actively demonstrate compassion, integrity, and our trust values, and we're able to refer regularly to our behaviours framework. I think if there's a chance for me, I'll drop the behaviours framework in here. I think it's super powerful. If you don't have it up on your wall already, might be worth printing it off and sticking it up, because it's very powerful in terms of what are our standards of behaviour and what is acceptable to us as leaders and what is not. Support is offered to leaders to continually develop themselves and their services. We act by example and we act as role models, and we engage in our staff experience. So when we think about things like staff survey and all the staff survey, the stuff that's coming out, is it a document that sits on a desk, or are you talking to your employees? And when they go into their focus groups with the CQC, will they say that they talk regularly with their leaders, us and their managers, about their experiences? We're accessible, we're visible and approachable, and we challenge poor behaviour. Again, back to that behaviours framework. Senior management cover is available at all times. Leadership teams are committed to staff wellbeing and flexible working. And again, it's those real life examples of how we as leaders are making that happen in practice. Our values of respect and dignity and kindness are displayed at all times. And we use values-based recruitment with people having suitable experience and qualifications for their roles. Back to that staff, it's a bit of a plug, isn't it, for my service today, but staff experience is a priority. We act on the staff survey and experience results, and we are able to show you said we did improvements and that we listen to our teams, and our staff will say when they're asked that they're involved in the decisions. You can call it co-design, you can call it being involved in the decisions that are made, and that's really, as well as some of the wider staff engagement and OD stuff, it's what happens where they work. Are they involved in the decisions that are made around their services, their patients and their communities? Leaders are able to identify and manage service issues, including safe staffing. We have a very clear understanding and grip on our risk and mitigation plans. We know what the risks are for our services, and we've got very clear plans in place to mitigate those risks. We enable our service to evolve and improve. And we've got a grip and control of service activity through things like our accountability framework and employee versus patient outcomes, freedom to speak up, concern themes, etc. So that we've got a grip on what's going on in our services. We know what our absence is like. We know what our wait times are like. We know what sickness looks like. We know what staff survey results look like, and so on and so forth. And we've got a grip on how things are where we work for our teams and our staff. We're recognising our staff locally and organisationally. Our staff are going to be able to say that they feel valued by you, by us as leaders, and that they see themselves being recognised for that work, even if that's just a tiny thank you or being nominated for awards, etc. And also, you know about the feedback from your last CQC inspections, because they will. The CQC inspectors will. So do you know, are you au fait? And can you talk to them about where you've acted upon things? Even if that's that, you know, things aren't amazing, we know, and again, this is a theme that's run through all of the sessions so far, we know what's going on, we know where our areas for improvement are, and we've got a plan to address them. I think, you know, certainly the CQC are looking for those assurances rather than that everything's hunky-dory and rosy. So before I go on to the next slide, Paul, anything else from your perspective on this slide?
No, thanks, Jo. It's really comprehensive. I just wondered from the
Excuse
group
me.
about what they thought what good looks like, and whether there's just you know, some experiences that you've got that you'd like to share with the group to help try and think about, you know, answering this exam question, as it were. So what does good look like to you as a manager?
All of the above.
Yeah.
I can't see if you've got any hands up.
If you do have any thoughts and reflections, just pop them in the chat or put your hand up, and we'll happily talk to them. Otherwise, Jo,
Thanks, Paul.
Masumi.
Ah, Masumi.
Masumi's great.
I was going to say that the key thing in all of this is about acting as a role model. So all that in terms of compassionate, clear, visionary kind of practices you should be doing as a manager, as a leader every day should be replicated to all, and that then obviously is reflected in the actual practice and delivery of care. The other thing I was just emailing you, Jo, to say that something I've developed for my teams, and that's learning from previous CQC inspections, is the development of what I've called a supervision tree. And that kind of sets out the diagram from a one-to-one all the way up through, say, ADs to the director to accountability framework and to ET, and also the quality kind of and safety pathways as well. So I'm happy to share that with you, Jo, if that's helpful for others.
Yes, please.
Yeah,
I think if you can drop it, I mean, if you've got the technical skills,
yeah.
I haven't, but if you can drop it into the chat, Masumi, for others to see, I think that would be really
It's an
valuable.
example.
It's that grip, isn't it? It's about, you know, knowing exactly what goes where and how that all funnels through. So yes, please. Thanks, Masumi. So I'll move on. So I've just got a couple of slides here that give some examples of some of our leadership. So some of the things that you may want to refer to, you may already be aware of, but just some examples of you know, things that we said look result in being a good leader. Obviously, we've got our senior management cover, on-call framework, operational structures, and a director's on-call handbook. In terms of being committed to staff wellbeing and experience, we have a whole range of wellbeing policies and procedures, supervision, here for you, occupational health, employee assistance programme. As you will all know, I hope, we are doing the round of staff survey improvement plans right now. So staff survey results are out, and we're working with you as care units to come up with some themes around how you can improve employee experience in your area right now. So if you weren't necessarily involved in that, do reach out to your care unit directors, because we've nearly completed all of the staff survey planning round now. So there are themes for your care unit. And that will continue down. So we'll continue to work through the organisation at team level. But you yourselves should have had now your team level staff survey results and be digesting those and understanding and be able to articulate what it looks like for you in terms of staff experience. And also, how do you engage? What is the engagement model for you? How do you talk to your staff? How do you engage on staff experience where you work as a leader? Examples of healthy workspaces: where do staff go for their breaks? How do they spend time together? What do they do? You know, do they have spaces that they can go to? Have you done any work around that? We have our people strategy, which has just been refreshed and has a strong focus around staff experience and inclusion, as well as commitment to all of the other elements of our people, including resourcing, etc. And again, back to that, you know, how are we hearing from our workforces? And we haven't started them yet, but we will be running some staff focus groups through the year. We've literally just had them signed off at our staff experience and inclusion group. So we're working with care units through the year, so that the CQC focus groups is not the only time we do focus groups with our staff. Just around our values and our behaviours, we do things like used value-based questions at interview. I should think there's no one on this call that isn't aware of those from the interview records that you've written and kept. We have patient stroke service user stroke MREN reps on our interview panels for band 8A and above. We have our values and behaviour framework, which is really, really good and really clear around the levels and the kinds of behaviour we accept and the kinds of behaviour we do not accept. And then some of you will have crossed paths with our work around trauma-informed approaches to leadership. So that trauma-informed care approach to recognising basically what goes on behind the eyes and understanding what's going on behind people, leaders and staff, that we need to be mindful of in our operations as leaders. Talent management, succession planning. We've got our King's Fund. Paul, I don't know if you just want to say a tiny bit about the King's Fund work.
Yeah, sure. So I think it's the first time EPUT had a working with such a major partner like the King's Fund, and we're really proud of working with them and a group called BRAPT, who are a leading equalities charity across England. And between the King's Fund and BRAPT, I'll be working with the senior leadership group to develop firstly a culture review, but then a bespoke leadership development programme. And that will include colleagues in the senior leadership group, but also those in sort of middle management, frontline managerial roles who can be part of that cohort as well, to give them exposure and support as well. So really exciting and interesting programme. It's going to give us loads of credibility with how we have leadership capacity development in the future. And this is the first cohort in September that will be launched following the cultural review, and then we'll aim to have that on a rolling programme. So worth sort of keeping that in mind and keeping your eyes open for the nominations when they come out. Thanks, Jo.
Thanks, Paul. Thank you. And then just a couple of other bits around leaders being able to identify and manage service issues, including safe staffing, and some of the examples there of our policies and practices and processes around adverse incident policy, our duty of candour policy, sit rep reporting, safer staffing, risk registers and accountability frameworks. Really good example there of GRIP. You know, what happens in those accountability frameworks? What do you know as leaders, and how do you triangulate that all together? And then, as Paul said, the King's Fund and BRAPT leadership work. And then just in terms of how experienced and qualified we have a code of conduct for our board of directors and a fit and proper persons policy. And then we use things like job descriptions, accountability framework, recruitment and retention policies, etc., to be very clear about our roles and responsibilities. Appraisal is something that we've just been talking about downstairs in our staff experience group. Score very well in staff survey results this year, but lots more work to do to improve our appraisal and talent management processes. But likely that could come up as part of your leadership conversation with the CQC. How we demonstrate compassion, integrity and trust values here, our vision and values, I mean, all tattooed on our arms. We all know what they are. Our behaviours framework, our equality and inclusion coaching and training, staff recognition and quality awards coming up. I mean, how timely. We'll be splashing those photographs all over the CQC and letting them know, you know, what a wonderful event it was for our staff. And then we have our fortnightly staff briefing, and I think it's important to note here that that is an opportunity for our staff to ask our executive anything. It was recognised in our last CQC inspection about something that happened in the Staff Engagement Champions Network. It was called a grill. We didn't really like the language, but what the staff did like was the opportunity to ask their executive colleagues anything. And so we've continued with that, and I think that's worth a mention because it was positively commented upon last time by the CQC, and I think it would be good for them to hear it again. And then all of the stuff we do around development, our OD framework, we've got our RISE programme for our global majority staff, and all of the leadership programmes that are available, including the work that Paul has just talked about with the King's Fund and BRAP. And then easy peasy, do this every day, leading by example, being visible, approachable, reachable to your staff, and any kind of schemes that you have that allow staff to have that connection with you as leaders. So I'm just going to stop there for a second and just see if staff have any questions or comments about that. Okay.
Joe, I just wonder if I think Janice Scott might be on the call, and whether there's something about inclusive leaders that Janice might want to reflect on with the group.
I am on the call. So inclusive leaders. I think is this what I was talking about before, Paul?
Yeah, so it's part of this sort of well-led standard.
Yeah.
So I'd just be really good to hear from you in terms of your freedom to speak up role, what you've heard, what works really well around inclusive leadership and what doesn't, maybe. That'd be great to hear.
Yeah, I mean, I did a session yesterday. The reality is, from staff perspective, what they would like and what they appreciate and what CQC will be looking to see is whether you have equitable processes. Are people allowed and are they managed in the same way? Because if we look at our freedom to speak up data, there is quite a bit around the application from a staff's perspective, are the unfair allocation of our systems and policies for some staff. So what they'd like to see is that actually everybody is getting the same opportunities, and as leaders we are listening, we are actioning, and we are recording what people are telling us. So it fits very much into what Joe was saying earlier on. How are you evidencing what you do? What's your engagement methods? What are you doing that's slightly different to what we're doing as a trust as a whole? Hope that helps, Paul.
Yeah, that's great. Thanks, Janice.
And then I've just popped in here just some examples. All of this information I'm sure is available to your fingertips for your areas, but just some of the data that informs the decisions we make as leaders around our vacancy rate, our equality and inclusion training, sickness absence, etc. They're just some examples in there of the kind of information you'll be expected to have a grip on for your service. I've just included here the front page of the workforce equality standards. So we have the workforce race equality standard and we have the workforce disability equality standard. All of the information is available on the intranet, but just a couple of headlines for you. We haven't published the res data for this year yet, or the WADES, but some of it is in the staff survey. So things like harassment, bullying and abuse from patients and the public has got worse for our global majority and our disabled staff. Harassment, bullying and abuse from staff to each other has got worse for global majority and has got worse for disabled, but has improved for white staff. So less white staff are experiencing harassment, bullying and abuse from each other, but more global majority and disabled staff are experiencing it. And the last snap is that the number of reasonable adjustments that are being made for disabled staff is improving again. So some of you will have heard us talking about the staff survey results and the fact that actually whilst things are stable this year, they're not yet back to where they were in 2023. So we've seen a little bit of a dip across the people promises, but now we're starting to improve again, but still we're not back to where we were in 2023. Excuse me, I've got a tickle. So there's plenty more information where that came from around race and around disability and around our staff survey. If anyone wants to go into a bit of a deeper dive or wants to know where their results are for their service, do reach out to me and I'm happy to get those across to you. So just the last couple of minutes and then we'll open the floor. For me and us, this is what the quality statement means. It's a bit of a repetition on the previous slide, but you know and have the experience, capability and integrity to ensure that the vision of our organisation can be delivered and risks can be well managed. You as leaders are visible and lead by example, and you model inclusive behaviours exactly as Janice described. There's consistency in the decisions that you make and the application of our processes to our staff. You're approachable. You walk your floors. Staff are able to say that they see you and that you're connected to the front line. And high quality leadership is sustained through safe, effective and inclusive recruitment and succession planning. We're knowledgeable about the issues and priorities for our services, for good quality services, and we know how to access support and development. And we have our ear to the ground. We are alert to any examples of poor culture that might affect the quality of care we deliver and could have a detrimental impact on staff, and they're addressed quickly. And again, that's the kind of stuff that will come out from the focus groups when the CQC meet our staff. You're very honest about where there's room for improvement and have clear plans in place to do so. I absolutely know that the CQC will take assurance from that, and that they, as long as they know that we know where our problems are and we have plans in place to address them, that's better than, you know, reporting everything is hunky-dory. And we can show that what we do and the decisions that we make are made with our staff and our patients and communities. As leaders, we co-design the decisions that we make. The information on the the information that they hear will be consistent throughout their interactions. So wherever they go, the staff, the frontline staff and the other leaders will all be saying the same things. And then lastly, as I said before, you know what's going on in your service, you know your stuff, you know your data, your activity, and your staff will report that you act on it. So Nicola, I'm going to close there. I'm going to stop sharing the slides, which I will drop into the chat, and open the floor.
Perfect. Thank you, Jo and Paul, for that really, really interesting session, and a really great reminder about some of the work, particularly things like our behaviour framework and some of the new work that's happening around the King's Fund, which I think is great for us all to be aware of. Any reflections, questions or comments people have, please do raise a hand.
I've just made furious notes, so apologies.
That's quite all right. Could I bring in Augustine?
Yeah, sure. Thank you very much, Jo and Nicola, for the presentation. Just a quick question. I know we don't know the dates where potentially any service could be inspected, but do you have any inclination which area they might be looking at predominantly as a community? Are we focusing on mental health, or is it, do you have, so that at least that we can be pre-warned and prepared in advance? That's my first question.
That's always a great question. At the moment, they are visiting our CAMS inpatient services. So they unexpectedly turned up last week, and we do believe they'll be back with us later this week. I still suspect they will visit our community services because they've asked for a list of all of our sites. So that's usually an indication that they're going to come. However, I thought they would have been here before March. So, you know, they aren't overly predictable in that. But I would anticipate a visit sort of in the next couple of months, really, if they're going to come for this, you know, for the current Well Led process. But yes, they did ask us for a list, so that's often a sign.
Thank you very much.
Did you have a second question?
I do. My second question was just interesting from the data that was presented that supervision and appraisal was quite, I think it was 77%. And I have been involved in supervision of the preceptorship component of it, but I'm thinking that how much are we taking the feedback from the newly recruited staff members and also across the service as a whole into ensuring that we are within the target objective of 90% really?
So so the question is Ask the question again, Augustine. Sorry.
I suppose it's just how much is there a focus for us as an organization in terms of ensuring that we are achieving the target? Is there something that we also need to be mindful of, or maybe just cascade, the importance of the supervision being a key aspect across all the services that we cover?
Yeah, I mean, I think Paul might want to come in on that. Paul, do you?
Yeah, it's a good question. I think, individually as line managers and leaders, we've got responsibility to make sure our team is well supervised and that it's meaningful supervision and that everyone has an appraisal that's effective. And there's a real listening exercise that goes with that, rather than just being a tick box exercise. So that's sort of individual responsibility. Across the trust, there is accountability frameworks that are executive-led committees, and they hold care units to account for a range of things around performance, but that includes supervision and appraisal activity. Clearly, it's not the only thing they focus on, but that is one of the areas of scrutiny that happens every month with each of the care units. I don't know if Emma's still on the call, but she'll testify that, we look at these people metrics because they do give an indication of how well led a care unit is. And Emma, if you want to come in.
Yeah, happy to. I mean, we're focusing on ours at the moment because we had a sort of bit of a hotspot with our urgent care team, which we've got up. We are struggling to get it up to 90%, but I think, yeah, absolutely. So we're doing a bit of a micromanagement of it in our area, but it is quite hard work maintaining that, because I know they're not just going to look at the month that you're in, are they? They're going to have a look at kind of a longitudinal review of appraisals and supervision.
Thank you. Thanks, Augustine. Great question.
Thank you.
Just while there's no hands up, I just wanted to pick up a couple of bits in the chat. Thank you so much for what you've popped in there. Sorry about the background noise. There's a couple of colleagues that said they haven't seen their staff survey results, so I'll absolutely get onto those and get those sent across to you. And then David quite rightly says that if a team is less than 10, I think it's 11, that there's no specific staff survey results for you for obvious reasons, as in you may be able to identify somebody. But I think what you're saying is something you fed back is to look at the wider teams within the directorate. Absolutely spot on, David, because I've actually got that in my team. I've got 2 teams. One of them was mixed into another team, so I don't have any staff survey results for them, but I think the work is the same. So we're working together on how we improve our staff experience for my service. We don't need to know, exactly where something came from. We know for us what some of those areas are, and improving it from, one side of the team will improve it for everyone. So thank you for, acknowledging that not having those specific team results doesn't mean you can't address your staff experience. I think it's a really good point. Thank you. And I can see, Darlene, you haven't seen your staff survey results. Leave those with me and I'll make sure that our team reach out to you. But what you can do on the intranet, I'll drop the link in here, all of the overarching staff survey results have been published now. So you can go on there and you can have a look at the kind of general staff position, and there's a bit of an overview as well. But I'll address all of those individual ones and get those sent across to you.
Brilliant. Thank you, Jo. Any final questions before I draw us to a close? Paul?
Yeah, thanks, Vicky. I think just a final reflection really is about sort of the honesty and integrity that we put within leadership. It's really important that if we don't know something, that we don't just make it up, that actually we say we don't know. It's really important to understand what you don't know as much as what you do know, because that shows that you've got a really thoughtful, reflective approach to your leadership. So my advice is, act with integrity, be honest with what you know and what you don't know, and that will go a long way with developing yourself as a leader in the future. So I hope that helps, and thanks for everyone's attendance today.
Thank you. David?
Yeah, I was just wondering what the potential was for non-care unit care units, as it were, as in non-clinical care units for the CQC to come in. So the likes of finance, the likes of information teams, digital, and so forth. Or are they going to be concentrating more on the clinical areas?
Thank you. Really good question. So the CQC in their visits focus on the clinical areas. And it's then in the Well Led inspection is when they do the triangulation piece. So what the CQC will do is part of the week that they'll be with us, they have a range of focus groups, and one of the focus groups will be with support services. So we'll be inviting people from across the support services. And what the CQC are going to be looking for is to see if the people in the focus group are saying and understanding the same risks and issues as what they saw when they were out and about, and what our clinicians have told them. So again, it's about that integrity and feeling confident and brave to actually say, yes, we know this is a risk, but this is what we're doing about it. This is, you know, this is our top issue. This is how we're addressing it. And that's what's so important with the CQC. It's being as transparent as you can, but they want to hear what you're doing about it. I also think, and I said this in one of the previous leadership sessions, that it can be very easy to focus on our risks and our challenges. Naturally, the way some of the questions work lead you in that direction. However, the CQC are here to hear about our successes as well. So I would always say, push when you're talking to them, highlight your successes. If you're in a focus group, or if you're in an interview, take the time to think about what do you want to get across to the CQC, because in our last report we had some fantastic examples of change and innovation and all sorts of things that we were doing, but that's only there if we tell them. So yeah, I would really have courage to take control of some of that conversation with them. But hopefully, David, yes, we'll all have an opportunity in the back office to speak with the CQC.
Excellent. Thanks for the answer.
You're welcome. However, they don't tend to turn up unannounced for any of us. So that is quite nice. Bernadette.
No, thank you. I was just going to say something that's really stood me in good stead as a manager here in collaborative care was our local trust compliance visit, and the outcome report that we actually received for that, and looking at all the different areas. And I think, you know, actually sitting with the compliance officer that came and looked at all the different questions that she had to ask really did stand me in really good prep if the CQC inspectors were to come, and just to look at any recommendations that we can take forward, or I can take forward as a team manager and a leader, really just for service improvement and development. And that is definitely a positive that I got from the trust compliance visit. So I found that very helpful, and hopefully that will be help us going forward should CQC come to my service. Thank you.
Thank you for that feedback. I shall share that back with the team. I'm sure they'll be really pleased to hear that. And I think a couple of members are in the background. But yes, that's a really good point. Have a look at your last inspection from when a member of the compliance team came to your service. We try now not to give direct actions, but to make recommendations, because we realise actually we need to give people room to actually create your own actions. It's not for us to tell you exactly how to do something. So I'm hoping that's helped create a much more collaborative approach where we think that perhaps there could be some improvements. But I would also look at some of your other things. So think about some of your most recent audits, and think about any quality improvement programs you've been part of. Again, us as leaders, how are we encouraging people to be part of those? How are we supporting people, giving them the time to be part of that? So yes, I would definitely sort of have a little look back so you've got that in your back pocket. Brilliant. Okay, well, thank you very much. We've got a couple more sessions to go. I do hope people are finding them interesting. And as Jo said, I think really, really important observation, there's a lot of overlap, and that's because Well Led does overlap. So really it's about giving ourselves that opportunity to connect the dots. I think we all know a lot of these things. It's just taking the time to step back and connect those dots and give us that golden thread that CQC are looking for. And thank you very much again to Jo and Paul for facilitating the session for us. Thank you.
Thanks all. Bye-bye.
Thanks everyone.
Thank you.
Bye.
Bye.
Bye.